everyone. I'm Sarah Cameron. I'm a motivational interviewing trainer. I'm a member of the Motivational Interviewing Network of Trainers, a tobacco treatment specialist, and a tobacco treatment specialist trainer. I'm here to speak with you today about motivational interviewing and the stages of change. So let's jump in. To start, it's helpful to do a little recap of a few MI concepts and principles. So let's start from the beginning. What exactly is motivational interviewing and what's it for? Motivational interviewing comes from Carl Rogers' idea. It's a person-centered approach with positive regard for people back in the 1950s. And then Bill Miller took those concepts and came up with what we now know as MI, and that was back in the 80s. So MI is a conversational style. It's a way of being with our patients. It's meant to be used to help people who make behavior changes, people who want to resolve ambivalence, and sometimes even to reduce discord. So for the purposes of a TTS, MI is used to walk alongside those who are on their journey to quitting commercial tobacco. So what's not MI? Well, it's not a way to pull someone where we'd like them to go or fulfill our agenda to get them to quit tobacco. We can avoid this mentality of dragging them to where we prefer they go by staying true to the components of the spirit of MI. So these components are partnership, acceptance, compassion, and what used to be evocation is now empowerment. So partnership, acceptance, compassion, and empowerment. So this means coming to our conversations with our patients that we're bringing mega compassion for their life choices, that we're being sure we're a partner, we're accepting of everything that they're coming with their preferences, and what they've been through with tobacco and where they'd like to go next, and doing our best to empower them to make whatever related changes to tobacco that they'd like to make, rather than drag them through what we want them to do or telling them that they need to quit. But today we're here not to rehash the basics of MI, but to talk about MI and the stages of change. So stages of change and MI are not the same thing. They're very complementary. Stages of change were created in the 80s, so was MI. Stages of change were created by Prochaska and DiClemente. And MI trainers talk about the stages of change because MI is used to help target that contemplation stage of change. So let's break down the stages of change or trans-theoretical model. The philosophy is that when people go through changes, in our case, reducing or quitting tobacco, they go through these stages in an order. So we have the first stage, pre-contemplation. This is the haven't yet thought about it stage. When they're not really thinking about tobacco-related things at all. They're maybe complaining about tobacco-related issues like shortness of breath. They're embarrassed about a smell. When they're defensive about their tobacco use, they're in denial. Like they've experienced maybe cardiac arrest and refuse to acknowledge it's tobacco related. This is all pre-contemplation, not even on their brain yet. Contemplation, the second stage of change, is the thinking about it stage. This is a stage where we hear arguments for and against tobacco use. It's like the back and forth. I'd like to quit, but, or I've thought about it, but. This is actually the stage that MI was designed for, to help walk alongside people and their thoughts to quit or not to quit. So let's remember, this is the stuckness, the ambivalence. It's important to really normalize that with our people, to normalize that ambivalence does happen. We all go through it. And this stuckness often leads to going back to that pre-contemplation stage. They might say, never mind, I'll maybe consider trying again later in the future. The third stage then is preparation. So preparing to make this change. This is the part where people might be asking questions. They might be gathering info about maybe how did other people quit? They might be starting to explore what quitting looks like for them. They might just start asking, how do I get my hands on some NRT? What might that cost? So they might be thinking about the Ds, which strategies might work for them when cravings come up. Maybe they're sharing with people in their lives their plan so that they can be forgiving when this person might be a little agitated as they go on their quit journey. And maybe they're going home and getting rid of cigarette rollers and any tobacco they had stashed away in their car or their garage. So these are all signs that this person's preparing. They're preparing to make this change. Preparation phase. So then there's the action phase. Moving forward, where people are just going ahead and they're going for it. They're doing it. They've got their NRT from the pharmacy or store. They've noted all the places that remind them of tobacco, and they've started to actively avoid these places, at least for a while. So these are people who are in the motions. The train has left the station, they're doing it. And the final stage, sometimes the final stage, is maintenance. And this is when being a non-smoker or someone who's kicked tobacco to the curb, living their new tobacco-free life has become a habit. It's all integrated into their new way of life. This is a time when we really want to reinforce and troubleshoot and support our patients really through this. Talking about how they might celebrate or honor being quit for a month or 6 months or a year. Talking about what challenging situations might come up that might tempt them to smoke, planning ahead for those times. We might even reinforce those strategies they've been using in the situation. So oftentimes quitting smoking itself is reinforcing. People will notice they're saving money, they can breathe better, they spend the time they used to spend smoking doing things they value. And folks really exit this maintenance phase once they've been quit for a while. The last phase that we don't love to see pop up, but it does, is relapse. Of course, in the tobacco treatment world, we know this is not always a full-on relapse, but perhaps like a little lapse or a blip. And maybe at this time, the person slips back to preparation again. Maybe they prepare by restocking their NRT. They ran out and oops, that led to a little blip. Or maybe they want to go back to stop hanging around people who smoke on their work breaks. Maybe they're back to that preparation phase and doing those items that'll get them prepared to give it another shot. So those are stages of change. So we have pre-contemplation, contemplation, preparation, action, maintenance, and then sometimes relapse. So a few things to be aware of. Our healthcare system is set up to prepare us to work with people who are in preparation or action mostly, honestly. A lot of times in a lot of different settings that we work in, we don't have the tools to work alongside people as they work their way through pre-contemplation and contemplation. So the cool thing is MI is designed to help people in those stages, particularly the contemplation stage. So that's one thing to be aware of. Another thing to be aware of is the stages of change are linear and also recursive. So they can be fluid. People can move through them like a nomad. They can move forward. They can go backward in the stages. Someone might be in pre-contemplation one time that you see them, and the next time you see them, they're into action. They've already moved into that stage and they're making it happen. Or someone might gracefully make it through all the stages and be back in maintenance and have a relapse and find themselves back in contemplation. So there's a big ebb and flow to these stages. It's not always once it's done, it's checked and done off the list. Another thing to be aware of is there's no prescribed time that people spend in each stage. It's completely normal for people to spend different amounts of time in various stages. Some people might be experiencing ambivalence about quitting and sit in contemplation for years, as we've all kind of experienced. Others may be there for a week or a few days and move themselves right into preparation or action. So MI is really designed to help strengthen their motivation to change, in this case, quitting tobacco. Another thing to keep in mind about these is that as a TTS who embodies MI when they work with their patients is, first, you have to be able to listen to your patient talk, really listen deeply in order to identify which stage they're in. And once we identify the stage they're in, then you have to decide which type of MI response is most mindful or impactful to respond to that stage of change. So let's talk for a minute just about a couple of tips for working with those pre-contemplation and contemplation folks. So again, pre-contemplation, this is the not yet ready to talk about it or explore it phase. It can be so frustrating. Someone might have experienced a heart attack that is directly related to their smoking, and they know it and we know it. Or they might be battling insurance companies about covering their oxygen at home, but they are still not willing to talk about quitting tobacco. This can be really hard to sit with our patients year after year in that pre-contemplation phase. And it can be very tempting to persuade, warn, threaten, try to get them to see. But we know this usually backfires. And when we argue for change, they tend to argue back against that change. So our overall goal here, if someone is in pre-contemplation, is to leave the door cracked open. So when they're willing to talk about quitting tobacco, they're more likely to come back to us and work on it. So here's some tips for working with patients in this stage. First tip, Check your attitude with the client. Make sure that you're really embodying the spirit of MI, you're accepting, you're compassionate. There's reasons they're not ready to talk about it. Number 2, affirm that decision of what they do and when they do it is up to them, honoring their autonomy, reminding them they're in the driver's seat. Ultimately, it's their life. They're the expert. They're the ones who will be living with their tobacco use and whatever consequences may or may not come of that. Number 3, acknowledge that they're not quite ready. You might say, quitting tobacco or cutting back is not something you're ready to talk about today. And then another tip is exploring what is important for them to talk about. You might say, quitting isn't important to talk about today, but what is important for you to talk about today? And then the hope is that if this relationship continues, when they are ready to talk about it, they can see us as the person who's gentle with this vulnerable topic. You're non-threatening. They're more likely to come back to us with their ideas around quitting. And then the last tip here is, in this stage, is exploring the positive aspects of the change. You might say, if you were to decide to quit smoking, what might be different or better in a few months or a year? If they start to argue even against that, they're not ready for this discussion. Moving to the contemplation stage and some tips there. Really, in this stage, ambivalence is normal, and knowing the benefits of change is not always enough to quit smoking. So when someone's in this stage, this is where the MI spirit and strategies really shine and come through. Anyone who's a TTS spent some time discussing the basics of MI and how it aligns with tobacco treatment. And when someone is in this stage, MI is a way to sit with them, be where they're at, sit beside them, accept and honor their ambivalence. It can be tempting to fall into that trap of moving right to goal setting. Oh, it sounds like they might be ready. I'm going to just shove them into the goals and resource offering. We don't want to do that. We want to sit with them where they're at. Some strategies to stay in that contemplative state with someone who's on the fence about quitting tobacco. Hint, hint, it comes in as ORs if you've ever been through an MI training, which is open questions, affirmations, reflections, and summaries. So a couple tips here. If someone's in the contemplation phase, they're giving you reasons for and against quitting. Ask them open questions. Help them really explore their reasons to quit or their reasons to stay the same. You want to really elicit that change talk. So if you've been in an MI training, it's the acronym DARN CATS: desire, ability, reason, need. Ask them of that. What is their perspective on that? Elicit their ideas, what quitting might look like for them. So it's the opposite of our instinct. We'd love to say, don't you know the health consequences? Don't you know the cost? Don't you want to quit? But what a difference it makes to instead ask, what makes you consider giving quitting a try? So the second tip here is affirmations, affirming everything they're telling you. You're somebody who likes to examine every angle before making a decision. You are detail-oriented. Also, along with this comes really emphasizing their autonomy. You're in the driver's seat. Where you go from here is completely up to you. And then, of course, reflecting. Reflecting is our sign that we're listening. It's communicating to them, I'm here with you. So they might give you ambivalence about quitting, and you can highlight that and end on their reasons for change. So smoking's been a best friend for you, and now you're realizing that it may have been an abusive friend you have to walk away from. So reflecting back their reasons to quit is one of the best strategies here. Some people will even say in the MI world, if you're unsure, reflect. And then the last tip is EPE. Again, if you've been in an MI course, EPE stands for elicit, provide, elicit. If you're to the point in this conversation where this contemplative person is really expressing feeling ready to prepare to quit, and you have some ideas, you have some resources you'd really love to offer, use EPE. This means you might say something like, would it be okay if I shared with you some ideas that other people have used in the past or some resources we have here? And then offer them, and then follow up with, what do you make of that? What do you think? If you're tempted to correct, that's called the fixing reflex. It used to be called the writing reflex. If that kicks into gear, shift yourself back and use some EPE to offer the advice that you'd like to give, the resources you'd like to offer. So overall, your goal is to invite conversation, create a space of compassion and non-judgment, invite awareness. So I really invite you to strategically listen to identify the stage of change and respond using MI appropriate tools. while empathetically honoring autonomy. So you want to partner and avoid the fixing reflex. Overall, the stages of change are fairly straightforward. They tend to make common sense for most people. To learn how to bring your MI basics a bit deeper and master identifying types of talk, knowing when to shift gears, how to guide conversations, specifically quick conversations strategically, consider taking additional MI trainings. You can visit the motivationalinterviewing.org website to find MI trainers and offerings. Or if you want more information on my MI trainings that are available, which I will note can be tailored to tobacco treatment, please don't hesitate to reach out to me directly. My email is sarah.cameron.minnesota@gmail.com. All my best wishes. Thanks everyone for listening. Bye-bye.